just want to thank you all so much for being here. This has been very informative, and again, looking forward to following up on many of the great collaborations the CD is involved in. Thank you. Thanks very much.
Thanks.
Excellent. So I think this, before we move to public comment, I just want to again thank all the presenters here for your presentations. It's been very informative. I think there's this is just, we're sort of laying the groundwork here, but I think there's a lot of potential opportunities, and appreciate everyone committing to helping try to figure out how we can develop some, hopefully, measures or standards for looking at the quality of care writ large for children with special needs, and also thinking about where might be some opportunities. We can either leverage funds, provide more coordination. It sounds like, I certainly know that there's been efforts at coordination at various different levels, at various different localities and so forth, and maybe trying to think maybe how we can do it in a more either systematic manner or provide more support for those kind of collaborations as well as we move forward. And said this is just the first of actually hopefully several hearings the select committee will be having. And as I will probably be around for more than a year or two, hoping that this is the work that we'll be doing for several more years as we continue to move forward for this select committee. So I want to just thank all the presenters, and now I'd like to open for public comment. We'll have a 2-minute limit on public comment, and I don't know which microphone. Maybe we just have people come straight up. So if people want to line up, do we have a sign-in sheet or not? Okay. Actually, if you can, when you start, please. Oh, okay. So why don't we have people at least certainly write your name and the organization you're from, and then come up to the chair. And again, I said we'll have a 2-minute limit. Okay. Welcome.
Should I go?
Yeah, why don't you go ahead and start?
Hi, I'm Dr. Linda Copeland. I'm a developmental behavioral pediatrician with kind of 4 jobs. One of them is with UCSF Fresno Pediatric Residency Program. I have a particular interest in early intervention. And for the Part C, there can be cost savings if we look at using mid-level assessments instead of diagnostic assessments for eligibility. Mid-level assessments like the PEDS-DM or the Developmental Profile 3. For every dollar that gets spent in Part C on eligibility assessment, that's actually $1 taken away from Part C intervention. If we shift to mid-level assessments, that decreases the waiting list for more formal diagnostic assessments, can get kids in earlier and get the intervention started.
Okay.
Thank you.
Thank you. Thanks very much.
Hi there, my name's Cristina Hildebrand, and I'm from A Voice for Choice. I wanted to bring up 2 points. One thing that really surprised me in listening to this hearing was that there was no mention of trying to work out why our number of special needs children is increasing in this state and across the country. And I would ask you to add that to your list of to-dos and to look at, why are the number of children with autism, with ADHD, with all of these chronic diseases increasing in our state and across the country. And if we can get rid of those underlying symptoms or whatever is causing that, we can reduce the burden on our schools and on our healthcare system. The other thing that I wanted to bring up is SB 277, which in it has a IEP clause that is not very clear. In the assembly hearing, you mentioned that all students with IEPs would would be able to go to school. That was your wording. When SB 277 went to the assembly floor, it was clear that that wasn't the wording in there, and the wording leaves it very open to interpretation. It does say that IEP students can get their services at school. However, there are issues there because many IEPs, if you look at how an IEP is written, it is written very broadly. So it may say something like 70% of the time that the child is in recess, that child needs to be interacting with other children. Does that mean that the child can only go to school for recess? How does SB 277 really fit into this? The other issue is that you only get an IEP, which is granted under IDEA, the Disabilities Act, you only get an IEP usually when you enter kindergarten and you have that assessment in a public school. You don't get an IEP when you go to private school, and you also don't get an IEP before kindergarten. Well, if you have to be fully vaccinated, well, you can get an IEP, you can get an IEP, but most children get their IEPs when they enter school at kindergarten level. Is that not correct?
No, it depends on the level of disability.
Okay.
Yes.
Sorry.
And, well, it's an on IEP discussion.
Okay.
And so looking at that, how do we look at those children entering the school and how they get their assessments?
Okay. Thank you. Okay. Next.
I'm Karen Fessel, Autism Health Insurance Project. There were a number of issues that came up that intersect with the kind of work that our organization does. There was a lot about falling through the cracks. So one of the people mentioned that residential treatment centers, it's not covered through Medi-Cal. And that's a problem because the Federal Mental Health Parity Act basically requires that this be covered through health plans. And now Medi-Cal is subjected to the Federal Mental Health Parity Act. It's exempt from our state Mental Health Parity Act, but it means that they're not complying with the federal law. And so that's something that I think we need to look at, and Medi-Cal needs to look at that. And also in other intermediate levels of care, such as intensive outpatient and partial hospital. They also need to be covered through Medi-Cal for our children. Something that we see a lot is with the falling through with the interplay between school and Medi-Cal. We're seeing a lot of issues with children need services. They need ABA services in the school in order to access the curriculum. And we're seeing that kids need this service, and they're getting a lot of pushback. Sometimes the schools won't let them in. They don't want the private person in the school environment, and sometimes the health plans are not paying. And we see it in the private sector, and we see it in the Medi-Cal realm as well. And so that's something that needs to be addressed. At some point, we'd like to have a hearing where we can look at how the implementation is going on the Medi-Cal issue, and I would hope that this committee would be able to address that. I don't know if it's something that you're interested in. Okay. And what else? Sometimes we tell people not to check the box that allows the school district to collect the money from Medi-Cal, and that's because we've seen problems with Medi-Cal refusing to cover things like speech therapy if it's covered in the school district. And we don't like to tell them that because we know that the school districts need that money, but we don't know what else to tell them if it's going to be used against them for getting services that they need that are medically necessary.
Thank you. Thank you. Well, thank you.
We can follow up.
Yes.
Hello, I'm Maureen OLeary Burness, and I recently finished being the co-executive director of the statewide special ed task force. And so one of the things that we presented to you and to every legislator in the spring was a summary of our report that was done after a year and a half of people looking at all of these same questions in terms of barriers to services and what could we do. So I just wanted to make sure that you are reinforced with the fact that while I absolutely love and appreciate that you're doing this, there really is a good body of work already started that we hope that you can use and that we'd be happy to help you with in any way we can.
No, I appreciate that. I know a lot of people have looked at different pieces of what we're looking at, and we're just hoping to bring things together. And I appreciate the time and the commitment that was put into that report, and we'll definitely look at the report.
Thank you. I appreciate all your work, too.
Thank you. Thanks.
Hello, my name is Linda Olsen. I'm a school nurse for Sutter County Superintendent of Schools, and I would say that my experience very much reflects what the nurse from Tehama County spoke to. I see small school districts that have a really medically fragile child that needs to come to school, and I'm the supervising nurse for the LVN that we hire that rides the van that transports because he's too medically fragile to be on the school bus. And that nurse is with that child all day doing the tube feedings, doing the nebulizer treatments, doing the assessments, calling me, going, what do you think? You know, I go to the emergency room, those kinds of things. And that small school district has a huge financial burden for that student. And it's not just one school district. There's several that have that experience, and I don't know where the funding is to help them. So maybe that's something you can address in your committee. Thank you very much.
Thank you. Thanks very much. Welcome.
Hi, Dr. Pan. I'm Sherry Coburn. I'm the president-elect for the California School Nurses Organization. Thank you so much for your support of SB 276, which did allow billing for non-IEP students. Exactly. We have been in partnership with the Department of Healthcare Services and Michelle Christoph and her team to help deliver a SPA. But when you look at reimbursement rates, DCHS and California schools split the Medi-Cal rate with the Fed, so it is a 50% match. And so essentially, when you are billing assessments, it's $40 an hour. Or when you're billing treatments, it's $40 an hour. And so when you look at the cost of services, the overhead, and that's what California schools get because of that match. It is an issue. The rates are low, just like with many others have shared. The other thing that is an issue, in addition to the lack of nursing services, is really capturing the health issues in school systems. How many children are, medically fragile, complex children? How many are on ventilators? How many are on trachs? How many do have diabetes? How many life-threatening allergies are there? We can look at the data, but in California, we really have no sense of that. So the need is really unassessed. And we can call on our school nurse partners to ask them about that, but we don't know. And, schools have worked really hard to try to help health plans with HEDIS measures. When I was practicing in school nursing, we would have asthmatic kids come to the office, auscultate lungs, listen, deliver nebulizer treatments, Prevental, rather than sending them directly to the ER visit, which happens now because the secretary has no idea how to do that. So when you're looking at cost savings or helping with vaccines or immunizations, we delivered 22,000 doses of influenza vaccine in San Joaquin County. We increased our student seat time, decreased pediatric hospitalizations. So when you talk about efficiency in HEDIS, it makes a difference. So I just wanted to thank you for your support and this opportunity as well.
Well, thank you. Certainly, kids spend, about a third of their time in school age in school, and so if they have a health condition, they're going to need help for that time. So, okay. So with that, I want to again thank everyone for being here, and adjourn this first informational hearing of the Select Committee on Children with Special Needs. And again, thank you so much for attending and participating. Thank you.